Hi, this is Amanda Bryant, and I wanted to go over ePCR, which is the electronic patient care reporting, and the various pieces that go along with it. So first I wanted to go over what is ePCR. So ePCR is an electronic patient care reporting product, and it is a collection of information, covers a variety of options that allow you to collect patient information and care details electronically, and this is used by EMS, emergency medical services personnel. So next I wanted to go over how NEMSIS and ePCR are transforming EMS records. So NEMSIS is the National Emergency Medical Services Information System, and it's the national database used to store EMS data from the U.S. states and territories. So it is a national effort to standardize data collection that is collected by EMS agencies no matter where they are. So it's a universal standard for collecting patient care information, and this can range from emergency 911 calls, and it can also range into non-emergency calls as well as inter-facility transports. So it's a collaborative system, and it's used to improve patient care through this through the standardization, aggregation, and utilization of point-of-care EMS data. And this is a product of the NHTSA's Office of EMS collaboration with the University of Utah, is the host for the Technical Assistance Center that is there. So now that we know what NEMSIS and ePCR are doing together, we want to know why. So what is the purpose? So the purpose is no longer do EMTs, paramedics, and first responders need to carry paper forms. So what used to have happen was each provider would fill out a paper ePCR, which is a patient care report on paper, for each transport. And that would get turned in, hopefully, to the correct individuals for data collection as well as patient care records. Well, it was very inefficient, and in 2001, it changed when the National EMS Information System, of course, developed a follow-up to the 1998 EMS Agenda for the Future. So this established the need for ePCR. And the ePCR, no matter the software, has embedded ICD-10 codes. And those are codes that are for diseases, signs and symptoms, complaints, anything and everything that you are selecting in an ePCR system as a intervention or a problem with the patient has an ICD-10 code embedded into it. So ICD-10 is the 10th revision of the International Statistical Classification of Diseases and Related Health Problems medical classification list, and it is by the World Health Organization and is needed for all tracking, data collection, and billing purposes. So next I wanted to over the compliance with CMS, which is the Centers for Medicare and Medicaid Services. So basically, Medicare and Medicaid incentive programs help to encourage all professionals, whether it's in the hospital or in EMS, to implement and innovate their way to electronic patient care reporting. So better reflecting it, they put it into a couple of stages. So stage one was to set the foundation for the programs by establishing requirements for electronic capture of clinical data. Stage two just expanded onto stage one criteria and focused on advancing clinical processes and ensuring meaningful use. So in October 2015, CMS released the final rule that modified stage two and that eased the reporting requirements. So it continues to come along, and basically CMS, the Centers for Medicare and Medicaid Services, are continuing to require this from all healthcare professionals. So where do we go from here? So healthcare providers are starting to make progress now on routinely sharing patient data between care settings. So right now the problem lies in we as an EMS providers have the ability to gather this data on an electronic patient care report, but we do not have the ability to gather data from a previous record on the same patient in a hospital system. So they and most agencies in the United States are trying to develop a software system that integrates with each other, no matter the system that your healthcare facility is in, as well as your EMS agency is. So this will enable EMS providers to search a patient's healthcare record, so we can find out any medical history, any medications, any allergies, and end-of-life decisions. And this is extremely helpful when your patient may not be able to talk, may not be able to think clearly or make decisions for themselves, as well as let you know that they might be allergic to a medicine that you may be giving them soon. So all of these abilities are needed in the development of this electronic patient care report and the interoperability with the healthcare agencies. So in summary, ePCR is a streamlined application, so no matter the software, that provides the ability to record patient care during transit. And this can go to the emergency room or any other destination inside of a hospital, intensive care units, surgery, etc. And embedded ICD-10 codes and the diagnoses and symptoms automatically assign the pertinent codes for billing purposes as well as data collection. And it is compliant with, and not only that, supported by CMS, which is the Centers for Medicare and Medicaid Services, as a way to streamline documentation throughout the healthcare systems. Innovation in accordance with the agenda for the future for EMS agencies, and that is from the National Highway Traffic Safety Administration.